Hey everybody, Dr. Rob Silverman here, Amazon best-selling author of Inside Out Health and ACA Sports Council Chiropractor of the Year 2015. I'm happy to host our first Facebook Live where we're going to talk about the gut's effect on brain health and immunity. What a great topic. Immunity, without question, is the top of everybody's consciousness, without question, with what's going on in the world today. So here's what I'd like everybody to do. Give me a shout out if you're listening. Tell me where you're from. I'm working off my phone, so you'll hear a voice. They'll be telling me who the shout out is from. Say hi, give me a thumbs up, share it with a friend, write a comment, ask a question. We've got 30 minutes. I'm happy to answer all and every question. I'm going to talk about protocol. I just want to say, so we can, without question, get it out of the way. These statements have not been evaluated by the Food and Drug Administration. The products are not intended to diagnose, treat, cure, or prevent any disease. So I'm going to share some things that I use in my office and some things that we found in the literature. So once again, feel free. Ask any questions, like, comment, etc. First, let's talk about the gut. 80% of our immune cells are in our gut. It's where our macro and our micronutrients are absorbed. Fascinating. So many people ask, well, why do we have the bulk of our immune system in our gut? It's really simple. The bulk of the toxins actually come from the foods we eat. So it almost makes a lot of sense. So what do we talk about gut health and in reference to brain health? Well, what you're going to find out in the next 30 minutes, as if you didn't already know, is the gut to brain is intertwined. It's connected. It's bidirectionally communicating all the time. So 35,000 foot view, whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. You have a neurodegenerative disease of the brain, you're probably better off, without question, doing some gut protocol in conjunction with the brain protocol. And the converse is true also. If you've got a gut problem, you're really not going to truly fix the gut without also addressing the brain. Because, like I said before, it's bi-directional, up and down, and innovating everything in. So this is like the full field, the whole idea. So once again, the gut, when we talk about the gut, we talk about the intestines. And in that, we're talking about the small and the large intestine. That small intestine is sort of a misnomer because it's not really small. It's actually quite long. It's small in diameter. It is about an inch, whereas the large intestine is about 2.5 inches in diameter. In addition, the small intestine has a thin, single epithelial layer. The large intestine has a triple epithelial layer. That thin, single epithelial layer that makes up the small intestine has the thickness of a wet paper towel. So obviously it's easy to pierce. It has semi-permeability. It's semi-permeable, the small intestine. It goes with its lymph nodes and its properties, i.e. its functions, which is to pass on digested food particles, nutrients, and water to allow them to get in the bloodstream. That kind of makes a lot of sense. However, anytime we have too much permeability in the intestine, we always refer to that either as intestinal permeability or increased intestinal permeability and or leaky gut, that poses an issue. And that issue is very simple. Specific things can pass. Great example of things that can pass that extra permeable gut. Pathogens, bacteria, viruses, other toxins, undigested food particles. Now, when they pass the barrier and they go into your bloodstream, now your immune system has to recognize it. And your immune system, which is very interesting, has two legs. Well, actually, technically has three legs. The first leg is barriers. So those barriers are skin, gut barrier, lung barrier, liver barriers, things of that nature. Once it passes the barrier, the two true arms of the immune system, your innate and your adaptive, now come to the forefront. The innate is something that God gave us. It was from day one. The innate is in search and destroy. It's neutrophils, it's leukocytes, it's macrophages. It's ready to go to work. It's blowing everything up. The second part of the immune system, or the second leg, is that adaptive or acquired. So it's acquired quite about 10,000 years ago, and it adapts to the situation. It is, without question, recognize and memorize, and that's B and T cells. The T cells come from the thymus, and unfortunately, as we age, the thymus decreases, and the B cells come from bone, which ultimately make antibodies. So now you've got a little overview of barrier, which is the first proverbial arm, and the two arms, which we have your innate of your immune system, and your adaptive and acquired. So they attack anything that passes, and they attack anything that passes that barrier. In that barrier, they start to attack it. You get an antigen. That's what we call something that passes the barrier, antibody effect. So they attack, and then you get localized inflammation as it continually occurs. Hopefully it doesn't, but as it continually occurs, it goes through the body, and you have it going through the bloodstream. You have systemic inflammation. In addition to that, you have something that's possible that they call molecular mimicry, leading to autoimmunity. Molecular mimicry. So the body confuses the antigen or let's say your knee joint, a body tissue. And why does it do so? Because there's something called a protein sequence. Everything has a protein sequence. The protein sequence of the antigens are very close and similar to the protein sequences of structures like your knee joint, like your thyroid. The example I use of a protein sequence is very simply a zip code. So zip code could be 10605, but all zip codes in that local area, 10601 to 10607. So at the time of stress, a lot of antigens coming out, your immune system gets a little confused, doesn't work all that well because you may have some comorbidities, and boom, it starts attacking your fingers. It attacks your knee joint, it attacks your thyroid, leading to autoimmunity. So the first point of immunity is in your gut, and what your gut protects allows to stay in. I think we have a question? No? Okay. So allows it to stay in so your immune system doesn't attack it. So the gut is an early entry point. 80% of your immune cells are in your gut. And it's very interesting because as a practitioner, and everybody who's watching, for the most part, there's practitioners, or if it's consumers watching, everybody's got to take care of gut. So I have some quick little things that I always like to say with my patients, and I even share it with my practitioners. What have you done for your guts lately? Do you have the guts to be healthy? So every day, everything's pointed at your gut. Now, your gut is able to communicate with your brain. It's able to communicate with your brain through 3 different methods. Number 1, it communicates neurologically, and it does so with the vagus nerve. And I'm going to get back to that because we're going to spend some time on that vagus nerve. Number 2, it communicates with your brain through blood, because your blood system, your body's all interconnected. And there's a multitude of different ideas. And one of the ideas is nerve, blood, and the third one being hormones. So your gut has different hormones like GABA, serotonin, and communicates with your brain. In addition to that, it communicates through your bloodstream. So when something comes out, it comes out like an antigen, gets in your bloodstream, and attacks your brain. Now, what's most interesting about your brain is that your blood-brain barrier is made up of the same proteins as your gut. In addition to that, your blood-brain barrier also is a single-layer epithelial cell. Now, what's interesting, and I did not forget about the vagus nerve. We're going to talk about that because I want to do a whole, little dissertation on that. In addition to that, your blood-brain barrier is different than your gut barrier in that when something passes your gut, it goes into your bloodstream and has that opportunity for immune system to kill it. And maybe it's just a little local going into your brain. That's right. So the barrier of your guts keeps it in your gut, but it goes into your system. Your blood system gives you that opportunity for immune system to kill it. Whereas once it passes your blood-brain barrier, guess what you're going to have? Neuroautoimmunity. It's a high chance of neuroautoimmunity because those antigens go inside your brain, and that's where you're going to get that inflammation. So what we want to do is we really want to stop it from reaching the brain. Some of the best ways to stop it from reaching the brain is to imbue the brain with specific nutrients and also always take care of your gut. Now, having said that, some of the things that go wrong with the brain or things that are top of mind are things like Alzheimer's and all neurodegenerative diseases. But some of the things that we're really looking for is amyloid plaquing and tau tangles, and we're going to go into that. Now, let's take a step back. Let's talk about the vagus nerve. Vagus nerve, cranial nerve number 10. It's the longest cranial nerve in the body. It goes from medulla oblongata down through the transverse colon. Attaches to the outside of the transverse colon. Now, the reason it attaches to the outside, or because it attaches to the outside of the transverse colon, it's afferent. It means it's sending sensory cells to your brain. The vagus nerve is anywhere between 80 and 90% afferent. So what does it do? It actually senses what's going on inside your gut. It senses the bacterial diversity, the bacterial balance. So without question, we want to use a probiotic that is full of different strains, species, and different biodiversity. It should be a plethora of different bacteria because your vagus nerve senses it. And when it does, that's how it afferently communicates with your brain. Your brain is only communicating with your gut 10 to 20%, a little different. So some of the things that you're really looking for are, without question, good quality probiotics because it has to communicate. Now, let's talk a little bit about what goes on in the gut in your microbiome or within your microbiota. Let's use some terms. Dysbiosis, the unleveling of good and bad bacteria. You need about 85% good bacteria to 15% bad bacteria not to have an unleveling. Dysbiosis is not good. So it's not 50-50 or 51-49, which means that you win class president. No, you need about 85%. The biodiversity, the different strains, is critical because the biodiversity in your gut is your superpower of your gut. So you, without question, need to take care of your gut. In addition to that, there's something in your gut called toll-like receptor 4, TLR, toll-like receptor 4. That communicates, and toll-like receptor 4 leads you down a path of stimulating NF-kappa B, which ultimately stimulates something in the news now called NLRP3 inflammasome. That inflammasome releases interleukin-1 beta and interleukin-18. Guess what can block the expression of toll-like receptor 4 when your leaky gut is expressed? And your leaky gut can be expressed by a few methods, which we'll get into. Omega-3 fatty acids. Omega-3 fatty acids are excellent for blocking inflammation at the gut. In addition, they aid in the biodiversity. And when coupled with a probiotic, they allow the probiotic to be more effective because they allow the probiotic to be more sticky to the epithelial cell. So you always want to take a probiotic with a prebiotic, which we're going to get to. Prebiotic is the ability or food to feed the probiotic. And you want to couple that with a fish oil or omega-3 fatty acid because it adds to the biodiversity and the stickiness to the epithelial cell lining. And of course, because we're talking gut to brain and gut to brain and immunity, immunity through the body and immunity in the brain, you want to take a brain product also. So we're building towards the crescendo, what we recommend. Everything that we talk about when it comes to the supplements always are supplemental to good lifestyle and diet. So clearly we want to eat always organic foods, whole foods, not fried foods. Keep your gluten, keep your dairy, keep your sugar down. That's a standard bearer, without question. I see you raising the...
Well, Dana said that her father passed young from Alzheimer's, and she has a single copy of the Alzheimer's gene. She said, my gut is so messed up, I have to correct this.
Yes. So when you say a single allele... Dana. Hi, Dana. How are you? Thanks for listening. So again, I'm not giving medical advice. I want to make that clear. I'm talking from a functional nutrition perspective. So you're talking about the APOE4 allele. Now you said you had one. What we're looking for is E4 over E4. So let me give you a quick dissertation. APOE2, very uncommon, very positive, not to have any brain issues. About 2% of the population has it. APOE3, which I have, E3 over E3. So understand that mom and dad each give one. Yeah, as we all know, that's where like 23andMe gets their idea because 1 and 1 is really 46. But each parent gives an allele. So for me, I have a 3 and a 3, which is the most common. About 70% of Americans have that, which means I don't have the genetic disposition to get Alzheimer's easily. Doesn't mean I can't get it. If I stop my lifestyle and I don't allow my epigenetics to be good and follow some of the things that we're saying today, we increase our possibility. You said you had one allele, so I'm assuming you had a 3 and a 4. But let me know, please. I'm looking over there at the camera woman. Dana, let me know if you have a 4 or 4. That's correct. You have more susceptibility to Alzheimer's. That's correct. And one of the best ways to decrease any neurodegenerative disease, and we all know this, is to feed our gut. Is to take care of our gut health, kind of like what we're saying. So I'm happy that you said that. I'll be waiting for Dana to get back in reference to that. Once again, we want to be able to populate gut. We also want to be able to work with our gut and allow it to have that biodiversity. So I do want to get back into that inflammatory NLR. You had a response?
Dana says 4. My dad had a double copy.
Oh, okay. So you had one copy. You got it from your dad, and your mom didn't give it to you. So you were 3-4. 4-4 is allele 4 and 4, greater chance. 3-4, not as great a chance. You don't want 4. So my suggestion is, if I may, keep your sugars down, watch your gluten, watch your dairy. We talked about that. Exercise. And definitely consider taking care of your gut. And, I'll mention some of the products here that I'm going to recommend. I think they're running a special, and, good luck with that all. And I am here to help. So I just want to cover one more thing before we get into the products, because I know we've been talking about 15 minutes. Is that correct? Okay. So I'm trying to keep it concise to 30 minutes, and I'm happy so many people have turned on and everything. Once again, share it, like it, do all the things that are necessary. Remember, I'm going to say it again, these statements have not been evaluated by the Food and Drug Administration. The product's not intended to diagnose, treat, cure, or prevent any disease. Took care of that. Again, that toll-like receptor 4 is a fascinating thing in that it's stimulated by something called LPS. And let's get back into your gut. One more thing. Lipopolysaccharide. Lipopolysaccharide is an endotoxin. The word actually says what it is. It's something from inside your gut. When it's expressed outside your gut, becomes toxic. So it's an endotoxin. Lipopolysaccharide holds on bacteria, or holds bacteria on the inside of the intestinal tract, but it's actually on the outside of that membrane. So I call it like the ivy. So when LPS is expressed, LPS leads you down a path of injuring multiple organs. One of the biggest organs implicated when LPS, i.e. leaky gut, is expressed is, of course, brain tissue. Because whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. That bidirectional communication between those two organs. In addition to that, while we're in the gut, here's a normal, healthy gut. This is what I show all my patients, semi-permeable. Here's a leaky gut, maybe when the expression of LPS is out. Here you go. And now it can open. Those are tight junctions. Those tight junctions we call loose junctions. And here's tearing at the epithelial cell lining. And each one is very specific and different. Let's talk about some of the things that I recommend. Let's go from the top down. Let's talk about a product called Amyloid Benefits. Have it all here. It is without question a supplement that's designed to support a healthy inflammatory response to limit the formation of amyloid plaques and tau tangles in the brain. We've all spoken about the tau tangles and amyloid plaques. Does anybody really know where the amyloid comes from? Fascinating. The amyloid comes from inside the gut. You have gut permeability, leaky gut. It breaks through the mucosal lining, comes through the bloodstream, comes to the brain, gets through the damage or damages the blood-brain barrier and gets in your brain. And that's where amyloid plaquing comes from. It's not just starting in the brain.
So Michelle wants to know, how can a person exercise if one has a full-time job and always busy?
That's a great question. So it's not easy. And I understand that. So I feel your pain because my day is, even though it was COVID-19, my hours were more utilized than before. I think I had more time working in the office 24/7 and traveling nationally and internationally. I'm looking for 15 minutes because health is wealth. So it's just an organization of time. Getting 15 to 20 minutes every day with all that you're doing will make all the difference, because what will happen is when you exercise, you'll feel better. Your body will function better. You'll be more efficient at everything else. And when you're more efficient, you'll find that time. So I feel your pain. I understand it. Let's just try and carve out 15 minutes. When you carve the 15, pretty soon you'll want to carve the 30. So within the amyloid plaque, here's some of the main ingredients. Colostrum is a key ingredient. It's an excellent source of proline-rich peptide complexes. These are critical signaling proteins essential for moderating the cytokines and controlling the immune response and support a healthy inflammatory response. Cytokines. We all know what a cytokine is because we've had this cytokine storm. Not trying to segue into that. Cytokines release these interleukins, and they come from these pathways that we just talked about, like when your gut is permeable with that NF-kappa B pathway being released. In addition, there's a formula that contains curcumin. I want to stop. Curcumin, what a beautiful herb. Curcumin decreases the inflammatory NF-kappa B pathway, and it also upregulates an antioxidant pathway, NRF2. In addition, we have some supporting nutrients called ashwagandha, pomegranate, and palm fruit bioactive complex. They help resolve a lot of amyloid and tau metabolism, limit free radicals in the brain, reduce inflammatory cytokine production, and of course, regulate the stress hormone release of cortisol when you're not feeling well or when you're stressed. Stress is very deleterious to gut health. So it's a full brain formula, an excellent choice for a brain formula. In addition to that, there's a fish oil that we call Brain Benefits. This fish oil works excellently in that omega-3 fatty acids are precursors to a multitude of resolution of inflammation. So EPA and DHA are critical elements, not only for gut health, but to help with the inflammatory process. DHA is the sweet spot. DHA is the sweet spot for brain health. It does a cornucopia of good things within the brain. Everybody knows omega-3 fatty acids are positive. And these omega-3 fatty acids that we're talking about in Brain Benefits are made from wild oily fish, because we always want the wild oily fish because they're higher. One, wild, less pesticides. Two, oily, more omega-3s. One of the biggest problems we have in America is our omega-6 to omega-3 ratio. Omega-6 comes from grains. They can be and typically are inflammatory. Omega-3 fatty acids, like EPA and DHA, are non-inflammatory. If anything, they imbue many different pathways to upregulate your anti-inflammatory pathways and support others to ultimately make resolvents and resolution. So big proponent of omega-3 fatty acids. Love when you eat them. Really think it's critical to supplement with them, especially when you're talking about the gut to the brain and overall immunity. Remember, it quenched down that response of LPS, toll-like receptors, to NF-kappa B. In addition, the third product in the sequela of, or if you will, the trifecta, is the Mega Probiotic ND50. And the reason they call it 50, it has 52.5 billion colony-forming units. There's a lot in there. It has 9 different strains of probiotics. So it really populates both your upper and lower GI, many of which are through the lactobacillus, which are critical, the bifidobacterium. So I'll give you all a bunch of them, and they are without question Bifidobacterium longum, Lactobacillus plantarum, L. raminosus. They work in great combination with the other two, Brain Benefits and amyloid benefits. So those three together, I found working in practice, once you go past 3 supplements, patients are like, whoa. Consumers are like, whoa. Doctors get a little scared. So 3 as a kit is an actually perfect approach. So we are getting close to the 11:30 mark. So what I want to say is, if anybody has any questions, say them now, because I'd love to address them. I'd love to engage the audience. How are we doing with the shout outs and everything?
Michelle wants to know, do these products cause side effects?
That's a very fair question. Do the products cause side effects? Once again, we said the disclaimer. If taken appropriately, we haven't seen any side effects. So again, I always like to take I personally prefer to take my supplements with food. I also personally like to take my probiotics with food. So sometimes the side effects are people get healthier. I'm trying to be a little funny. Do we have another shout out on that? How are we doing on time? Because I don't want to go through a whole dissertation and have them feel that I kept them too long.
We have 6 minutes.
6 minutes. So fabulous. So once again, I really want to emphasize, or if you will, re-emphasize the need to take care of our gut and brain. So in the gut to brain axis and everything in between. So let me give you some other things when the gut runs aberrantly. Well, when you have leaky gut, and you have an expression of toxins, an overexpression of toxins. 75% of the toxins that pass your gut, go in your bloodstream, get to your liver. 25% of the toxins in your gut go to your liver via the portal vein. So when you have a problem with your gut, you also have an overload of toxic chemicals and you can get liver dysfunction. So there's a gut to liver axis. Now that's real interesting in that the liver has the most amount of macrophages in the body. Those macrophages cause inflammatory issues. I know I was trying to stick with the direct gut to brain axis, but I just wanted to show you that if you have a gut problem, which a lot of people do and most people do, what causes a gut problem? Well, gluten, Gluten means glue. It sticks to your intestinal tract. Remember, whatever you do your gut, you do to your brain. It sticks to your intestinal tract. It damages what we call your microvilli, which are shaggy carpets, which grab nutrients which are critical. When you have leaky gut, you're not able to absorb nutrients. You get hungry. You're nutrient deprived. So people who have a hunger problem also have an issue and they want to eat more. So if you fix your gut, you won't be as hungry. In addition, you won't have the release of extra hormones, especially that stress hormone that we talked before, which was called cortisol. Yep.
Cindy wants to know if the probiotics need refrigeration.
Probiotics are suggested to be refrigerated, though they don't need refrigeration. But we always suggest it. Why? Because we can always guarantee, or theoretically you can guarantee, temperature stable. You like temperature stable with probiotics. So my suggestion is to refrigerate them because, the temperature changes. I have 2 zones in my house. Sometimes they don't work. Even in my office, I can't guarantee it. So my preference is in the refrigerator. That doesn't mean that you can't have it delivered and not be in what they call room temperature. That doesn't mean you can't put it in your pocket from the doctor's office and go home and take it. It's not what we're talking about. For extended periods of time, the preference is refrigerated, but it does not have to be. By the way, one little side about those probiotics, they're also dairy-free. So in addition, other things that can damage the gut are dairy. I know people say, oh, dairy. High sugar content, non-steroid anti-inflammatories, NSAIDs, Aleve, ibuprofen, Advil. They can also damage your gut. Lectins are something that can damage your gut. Antibiotics, toxins from the air. So these are all things that can damage your gut. Your gut's a little sensitive, gut feeling. Your gut can be a little sensitive, and when you damage that gut, it perpetuates so much health or lack thereof health. So in addition, where you have that gut-to-brain axis, you also, believe it or not, I just want to throw this out, and maybe on next month's Facebook Live, we'll address a little more, something I'll be talking about in 2020 when we get the gut-to-lung axis. So that gut is your center point. Nothing better than feeding a good quality probiotics. Nothing better than feeding it fish oils. Nothing better than taking care of your brain. What's funny is that most people don't realize that brain is critical. It's the chip. I had a patient come in the other day with neurodegenerative disease. Nice guy. He's been a patient for a while, going through a lot, seeing some specialists. And through the specialists and a functional medicine practitioner, which I'm surprised that he was never told to take gut supplements. He was never told to take any brain supplements. And he was not told to change the things that irritate the gut. And the first thing is what you put in your mouth. So we had a nice conversation. I made some supplemental recommendations, and I made some key lifestyle recommendations, and they were exercise, because exercise leads to the biodiversity in your gut. And I also made the recommendations to taking the needed supplements and, of course, taking out the foods that were so detrimental to the gut health and the ones that we mentioned or aforementioned. In addition, there's one little thing that I'd like to mention. Sometimes food sensitivities. Food sensitivities can lead to the damage of the gut. So I think we have a couple of minutes before the wrap up. 2 minutes. I'm going to give you guys a last chance to ask a question live. So I'll give you 10 seconds for that. I've had a great time here. I think that you guys also will find this helpful. I appreciate everybody checking in. Not only to that, everybody checking in. We're going to do this again next month. We'll advertise this early. I really appreciate all those people asking questions. You can ask questions. Obviously, people are going back to work or back at work, so we can do it either live or, if you will, Memorex. We'll get you those answers. We're checking the social media 24/7, 365. And I think we got a question in under the gun.
Joanne wants to know, diverticulitis?
Diverticulitis.
Yes.
Hi, Joanne. Diverticulitis.
Food to avoid.
Foods to avoid. Well, diverticulitis is a little bit more complex than given credit for. However, obviously, with the diverticulitis and the out-pocketing, if you will, obviously any kind of nuts that are small can go in there. I'm a big proponent, once again, of avoiding foods that irritate you. So the aforementioned, and I'm not opposed to people taking food sensitivity testing. What a great choice to take food sensitivity testing to see where you are. Once again, If anybody's interested, we've got that package of those 3. There's other products that you could look at. I'm going to take a little creative license and tell you there's also a 4th one if you want to know, and that's the GI Benefits. It's a great powder to help your gut. Did we have any other questions or shout outs? So I will be back. Anybody who needs me, I'm always there for you. I wanted to keep it nice and concise to 30 minutes. 3 products. Answer any of your questions. Remember, all health and disease can begin in your gut. What have you done for your guts lately? Do you have the guts to be healthy? Remember, the gut-to-brain axis is a critical element, and it's a critical element in overall immunity. My pleasure, Dr. Rob, always yours in health.